Hello there, my name is Adeze and I am a clinical psychologist with the Nguvu team. Today I am going to be talking about ADHD, what are some of the symptoms and how can it be managed. ADHD stands for Attention Deficit Hyperactivity Disorder. It is a persistent pattern of inattention or hyperactivity and impulsivity. For some individuals, they provide more symptoms or they present with more symptoms of inattention. For some other individuals, they present with more symptoms of hyperactivity and impulsivity. I'm going to run you through the 9 different symptoms that ADHD presents with for inattention and the 9 different symptoms for hyperactivity and impulsivity, okay? And then we'll further discuss what the details are. So first of all, with inattention, the individual makes careless mistakes or lacks attention to details. The individual has difficulty sustaining attention, does not seem to listen when spoken to directly, fails to follow through on tasks and instructions, exhibits poor organization, avoids or dislikes tasks requiring sustained mental effort, loses things necessary for tasks, easily distracted by unrelated thoughts, and is forgetful in daily activities. So I mentioned 9. And for hyperactivity and impulsivity, again, fidgets with or taps hands or feet, leaves sits in situations when remaining seated is expected, experiences feelings of restlessness, has difficulty engaging in quiet activities, is often on the go and acts as though driven by a motto, talks excessively, blurts out answers, has difficulty waiting their turn, and interrupts or intrudes on others. Yes. Now, sometimes people present with all of this. However, to be diagnosed with ADHD, if you're younger than 17 years of age, you need to present with at least 6 out of these 9 symptoms that I mentioned for at least 6 months in at least 2 different settings. Now, if you're older than 17 years of age, you need to present with at least 5 of these different symptoms in each of the category or either category for at least 6 months in at least 2 different settings. So you kind of see that it looks different for younger people and it kind of looks different for adults as well. Okay, now what are some of the causes of ADHD? Some of the causes of ADHD are unknown actually, but for most times research has shown that it is biologically caused, genetically related and explained. Research also shows that some environmental factors can play a role, but most of the causes attributed to biological reasons. Now, how can we treat or manage ADHD? In this video, I am going to direct you to really go back and listen to some of the symptoms. If you feel like you, for any reason, meet the diagnostic criteria that I mentioned, or you're presenting with some of the symptoms, then it is indicative that you need to take the next step, which is to seek professional help. Working with a professional really brings a lot of light to the situation that we're dealing with. It helps to develop some life skills that can help us, because again, we see that for some people they exhibit poor organizational skills. For some other people, they have difficulty sustaining attention. For some other people, they talk excessively, and these are all skills that in therapy you can learn. Again, I can't necessarily give you a generic direction here, and that's only because ADHD is so individualistic. People experience it differently. I could be experiencing ADHD and my 6 symptoms will look different from your 6 symptoms, and for that reason we need individualistic guide to be able to manage ADHD. Okay. People also make use of medication, but again, medication has to be prescribed by a professional, leading me back to my first point that we need to take the next step to work with a professional. I must say that even though you've met some of the symptoms, it doesn't mean that you have ADHD. It is indicative that something might be going on there, but we can only diagnose with ADHD if the symptoms are not attributed to any other medical condition like depression, anxiety, schizophrenia. If it's explainable by any other condition, then maybe ADHD isn't what is going on there. I'll stop there for now, and I'll encourage you to take the next step today and seek professional help if you feel like you meet any of the symptoms. If you have any questions, you can send us a message on Google, or leave a DM, leave a comment, and we'll be sure to answer. Until then, we'll see you in our next video. Be good.